Welcome everyone this morning or this evening, depending on where you are. Latif Dramani, who is going to be speaking to us about the demographic dividend in Sub-Saharan Africa. Latif Dramani is a graduate in economics and PhD in economics from the University of Cheikh Anta Diop of Dakar in Senegal. Professor Dramani is a professor of economics at the University of Thiès and coordinator of the Center of Research in Economics and Applied Finance of Thiès. He represents the NTA International Executive Council for Francophone Africa, and he is also the coordinator of the Regional Center of Excellence for Research in General Economics, CREG. He's affiliated with several universities around the world, University of Manchester, University of Berkeley, University of Parakou, University of Cape Town, University of Hawaii at Manoa. Professor Latif carries out research in different areas, such as development issues, sustainable development goals, demographic dividend, generational economy, poverty dynamics, unpaid household work, and women's contribution to GDP, and finally, the national and local integration of economics. Before I welcome Latif, and so we can be on the same page on his talk, we are going to display a quick video on demographic dividend so that we all have a general idea of what demographic dividend is. And after that, we are going to welcome him for his talk.
What is the demographic dividend? The demographic dividend is the economic growth that can result from favorable changes in a country's age structure. When there are more people in a country who contribute to the economy than depend on it, and the right social and economic conditions are in place, a massive economic surge can occur. To achieve the demographic dividend, countries need to invest in women's empowerment, health, quality education, and employment opportunities. Empowerment, so that women have the rights and freedom to define their lives, including to decide if and when to have children. Health and education, so that boys and girls are strong, healthy, and have the schooling and training they need to succeed. Employment, so that people have job opportunities to put their skills to use and contribute to a growing economy. At the heart of the demographic dividend is ensuring women have access to contraceptive information and services. That's because when women can choose to have smaller families, they and their families enjoy better health, education, and economic opportunities. On a national level, a country's fertility rate declines, and a higher percentage of children survive and grow into healthy adults. The population age structure shifts with a larger workforce and fewer dependents. When this larger workforce is healthy, well-educated, and productively employed, a country unlocks the demographic dividend. Contraceptive access drives empowerment and complements investments in health, education, and employment, setting the stage for countries to enjoy accelerated economic growth and improved quality of life. Invest in family planning. Invest for a lifetime of returns.
Merci à Jean-Christophe pour l'opportunité.
Thank you for this opportunity. Thank you to the Gates Institute to offer this opportunity to Craig and Crayfax to present this work that we have undertaken with our team of researchers in Senegal. This is Professor Latif Dramani. In this presentation, we're going to present the background, the situation of COVID-19 in Africa. and also how they are the COVID-19 channels and the SDG, the conceptual framework, the data and hypothesis source, and the descriptive scenario. We will speak of the results on the Senegal study case and the impact of COVID-19 on the support ratio DD and on social dimensions. And then we will look at the next steps. In terms of the situation of the pandemic in Africa, we have a very alarming situation, as we all know. There are many cases, more than 611,000 cases, many deaths. Even though Africa has 13,000, still it is terrible. We know that other countries have been touched far more, and in Africa, some countries have been touched far more than others. But there are deaths in almost all African countries. Here we have the conceptual framework of the impact of COVID-19 and on SDGs. What we need to retain from this graph is that all the SDGs have been impacted by the pandemic of COVID-19. And so this brings us to the socioeconomic impact within the framework of NTA, and then the data sources and the scenario. In terms of NTA, fundamentally, we have the identities on the right that show the labor revenue plus assets represent the letter A, and they equivalent the spending, the savings, and the transfer of revenues for each age group. And this identity is valid for each age group or age year. So the first identities, we're going to see that the spending, look at the spending, and see if there's a deficit. And we will, for all the countries in which we worked, there was a deficit rather than a surplus. And this is financed by the government, and it's also financed by personal assets. And from this, we can look at the principal indicator regarding the classic NTA, that is the support ratio, which is the number of producers that are taking care of the others who are not producing. This first dividend was captured as the ratio of the growth rate. So with the life cycle deficit, we can capture and study the dependence ratio, and we are able to analyze the dividends of a country for the youth. We must remember that the NTA and all of these identities are compatible with what has been put out by the United Nations in terms of supply and demand, and using the socioeconomic status of those studies, using the different activity sectors. And all of this is done within the conceptual framework of NTA, and this is what we used. And so we put together an extension, which is to work with composite indicators to then synthesize the indicators that will follow the demographic dividend for the different African countries. And this is conceived with the roadmap of the African Union and also that of the UN with 2063 and 2030 for their program of the UN. So we have the DDMI, demographic index, and we are looking at 5 different dimensions of this. The economic dependence, so that the quality of life, the question of poverty, the human development, and then the networks and infrastructures. And you can see all of these. These are the different dimensions for the social needs on the economy. So there's the labor revenues, labor income, that we can see everything that is happening on the market, the local domestic economy. Then we also want to look at the quality of life, sanitation, security, social capital, time for leisure and self-care. That all concerns better life. Then everything to do with poverty. So household baskets condition, food poverty, time poverty gap, also the lack of free time. And then we want to look at the human development, everything that has to do with basic social needs, health expenditure, living standards, education expenditures. All of this is analyzed through the lens of gender and different activity sectors, and of course networks and infrastructures, remittances, transfer flows, access to financial services. And all of this is done at the national, subnational levels. And then we want to present the data and hypothesis sources. We have data that comes from the National Statistics Office, from the data coming from the Economic Policy and Planning Department, from the Economic and Social Resilience National Program Riposte against COVID-19, the Demographic Dividend Monitoring Index. Then also it's based on, we do forecasting and economic studies department. And then we have an economy task force that responds to COVID-19 from the Ministry of Higher Education, Scientific Research and Innovation, of which we are a part as researchers. And then also the work that is coming from the World Bank, the reports from the World Bank on the situation of the regions and the countries. So we have 3 scenarios here. The first one is what we call the optimistic scenario, which supposes that the crisis will end in the short run by July, and that economic activities can start from the 3rd quarter of this year. The medium scenario is suggesting that the COVID-19 crisis will last until the end of the 3rd quarter, and that economic activities would postpone these activities to the 4th quarter. And then the pessimistic scenario suggests that the crisis will persist through 2020 and that economic activities will not start till the 1st quarter of 2021. So then we have hypotheses that are linked to these 3 scenarios. These hypotheses, we have looked at different dimensions: the life cycle deficit, the dimension of human development, of poverty dynamics, and others. As concerns the life cycles deficit dimension, we chose with the experts of the country of Senegal to work with the following indicators: the self-employment, labor income, general labor income, spending by age, earnings. We also chose to work in synergy with looking at life expectancy, rates of fertility, and in terms of poverty, we chose to work with food consumption, access to social services, infrastructures, and poverty trap and poverty exit. Everything to do with the poverty trap and how to get out of poverty. And on the other indicators, we looked at the GDP growth rate. And this led us to the results that we brought earlier. We chose to look at two scenarios. We had three, but we simplified it down to, for the synthesis, the summary, we're looking at the optimistic scenario and the pessimistic one. We should also say that today the situation in Senegal is such that we are in the pessimistic scenario. So in black, you have the baseline, the solid black line. You have the rate. You have the profile of labor income. And in the dotted black line, you have the profile of the spending by age. In the green solid line, you have the support ratio, and in the dotted green, you have this for by age. So for the spending, we have the level of spending in dollars for each age group. So what we can observe is even in the optimistic scenario, there's a tremendous drastic drop in income. Spending has raised just a bit because it's an optimistic scenario. People think the crisis will not last much more than a month. So people are not really being careful. They're spending. But on the pessimistic side, we're anticipating that the crisis will last longer and the level of spending has dropped. It's the dotted red line. It has dropped drastically. And you can also observe that the revenues in the solid red line has also drastically dropped compared to the black lines. So there is really, we're under $1,000 for labor income, work income. In terms of indicators, we can see that the support ratio baseline was 43.5%. So about 45% of people were needing assistance. And then we have dropped to 42.2 in terms of the ratio of support in the optimistic scenario. And the demographic dividend also went down a bit. And in the pessimistic scenario, we see that the support ratio has gone down to 39.8%, almost 40%, and that the DDI also dropped drastically, and it's 0.34. So these, when we did these calculations, we saw that the drop in support it can be seen in a loss of jobs. Between 1 and 3 million jobs lost. So it's a catastrophe for the country. And this is what we see on the social indicators, social dimensions. So the economic dependence coverage dropped from 37 to 3%. The Better Life Index dropped by 4%. The Poverty Index increased by 3%. The Human Development decreased by 3%. And the Networks and Infrastructure also dropped. On the social plan, on the social level, we looking at what has happened over the last few years, the last 15 years, we've been measuring the real contribution of women to the economy since 2005, so 15 years ago. So we see how the situation has evolved. We see the situation has benefited men far more. In 2005, we see a dominance of the inequalities between men and women. The spending has remained about the same. For what we noticed in 2011, there is a class of women who are beginning, between 40 and 60 years old, who are beginning to be self-reliant, but the women, the gaps between the men and women remains very large. And this leads to calculations that we made, the Gender DD Index in Senegal. We see that the Gender DDMI shows that the men are doing, have a much higher rate of GDDI, 91% for men, 3% for women. And so men are economically independent, but here you see that only 3.7% of women are economically independent. So compared to men who are 91.3% economically independent. So in terms of human capital, women also had a problem that men did not have, where the gaps are not so large. They're similar. It's at the level of networks and territories. For men, it's 20.4%. For women, 16.3%. It's almost the same, but women are still lower. So if we look at all of this within the context of the COVID-19 impact, so men, the economic dependence coverage for men dropped drastically from 91.3% to 6.9%, but for women it went from 3.7% to 0.3%. So it's a terrible situation for the economy of the society. In terms of the Better Life Index, men lost 4.9%, women decreased by 5.3%. In terms of the Poverty Dynamics Index, men increased by 4%, women increased by 5%. In terms of human development, for men, it decreased by 3.8%. And for the networks and infrastructures, for men, decreased by 2%, and for women, 1.6%. And so the men who before were at 49.8% of GDDI, in terms of the contribution to dividend demographic, now we see they've gone to 27.8%. So women who were at 25.9% of GDDI, 26%. When we compare it to 50% of men, they are still currently at 14.5%. So we see a drop for women of about 11 points. The disparities were weighed. Everybody dropped. We see that the social situation is very tense with all of this. And so we are currently today finalizing our studies, our research, the impact report at the national level. We presented it to the government authorities, and now we are working on the impact on the regions at the regional level, and we're hoping to have more clear information on this, how to calibrate, how to measure the interventions that were caused by COVID-19. We want to study the situation of women. We want to finalize the study of the impact on gender, finish our gender analysis, and also concerning the derivations for each sector to see how the COVID-19 has impacted regions and how the state can respond to all of this. We are also working to finalize the riposte plan, the response plan, with $2 billion for the riposte against COVID. We have a huge gap to fill to reach the level we were in before COVID, because we know that $2 billion US will not be sufficient to correct the problems from COVID-19. We are also working with other research institutions, our partners, USBH, and other research institutes, to analyze this research, to understand also everything that's happened in terms of violence, forced marriages, everything that is connected to the SDGs concerning women. We know that there have been many impacts on women. So we are working on this, and we're hoping in a month or a month and a half that the results of these reports will be available. Thank you for your attention. Thank you to the Gates Institute and to the entire team of the Gates Institute. I think now we can probably move to the question and answer section.
Merci, Latif.
Thank you, Latif. We have already received one question. There is a question asking if you, when you speak of the levels of jobs, are you speaking of those that are reported or non-reported? Thank you. The numbers that we have for this scenario, they are linked to the National Register. We are working in Senegal and in the region, as you know. We have databases that allow us to have numbers for our country. And it might not be exactly perfect because we also have seasonal workers. But these are numbers that are official numbers of Senegal in terms of on the question of the number of employed. I don't know if you want me to directly answer the chat or if I should wait for you. Yes, if you like, you may. So Monsieur Agassi asked about the pessimistic situation. We started very early to undertake this study. We started in April. We finished the protocol, and we were thinking the crisis will not last long for us. But today, the scenario pessimistic has become the more logical and likely scenario, because we do not yet know. It could get much worse. So with the services of we take a new look at all of our forecasting. So we were looking at being around 3% of we were looking at the GDP before and after, and with COVID we thought that the first scenario we're going to lose 3.7%. Today, those of us looking at economic forecasting based on information we have, we think it will be 20%. And based on these hypotheses, people thought we were extremely pessimistic. 20% was too pessimistic, people thought. But today we are not sure if this is the case. That's for the question of Mr. Agassi. So the question regarding 8,000 positive cases. So the income is linked to the structure of the economy. If we look at the situation in Senegal, what we have observed, that with the crisis, the entire third level sector, everything that is restaurants, bars, hotels, the tertiary sector, behind all of this, there's an entire sub-economy. If we look at the contributions of this tertiary sector of restaurants, hotels, bars, all of the work regarding hotels, restaurants, bar has been stopped. So we can look at, one must see the direct effects and indirect effects. For example, if you have 20,000 people who lose their jobs and themselves, they finance the informal market, self-employed market, they support others. You're going to maybe support financially your brother or your cousin who has some kind of self-employment, informal employment. You can no longer support them because you have lost your work. So we also have the question of the borders that have been closed. There are no more flights, no more tourism, and all of this. And so in our countries, the entire economy has had a meltdown. So the state must pay, the government must pay to make up for what has been lost on the private economy. So the state, the government has had to put in a lot of money to make up the difference. And so even if we have the impression that it is not so bad, and even if we don't have that many cases, we know that the economic impact and the social and economic impact is very harsh. The president will say we must save the economy, of course. And so that is the situation we're in today. It's quite dire. Thank you, Latif. I think there is another question related to what you just said. How are these changes due to COVID-19? And are there underlying factors or other factors that COVID-19 has affected economically? What I just was saying, yes, it is, all the sectors have been touched. We have not suffered as much as Europe or the United States in terms of the number of deaths or the number of cases to date, but the dependence dividend of our country has dropped dramatically. What is the condition of our economy? Senegal has an extrovert economy. At the level of self-employment and formal economy, we had many, many jobs, and this informal economy depended on the diaspora, the Senegalese diaspora, on foreign income, and all of this has dropped dramatically from one day to the next. For 3 months, this has gone on. It's what we call in Senegal, we close the bars, the restaurants, the hotels. So all the people that worked in this sector have nothing to do. Nobody is buying anymore. There are no more flights. The borders are closed. There are no more foreigners. The other thing is the transfer of money from the diaspora. This is part of the hypotheses. We didn't want to enter all the hypotheses in the synthesis, but there is one on the transfer of funds from the diaspora outside of the country. At the diaspora, since can no longer send money like they used to. And the first trimester, the first quarter, there were not many official statistics, but we did a study in 2013 for the government of Senegal, and we learned that a great part, more than $1 billion, was part of the informal economy of Senegal. It's a system that is between families that are self-employed, have small jobs that they create themselves. And all of this has been eroded. Perhaps we will see new numbers before the end of the year. We didn't explicitly mention it earlier, but we took this into account, that the diaspora plays a large role to stabilize this country, but they too have suffered during the crisis, and so we have suffered doubly. People have not been able to travel because the borders were closed. So it's a social crisis here, and then there are social crises for those who are outside of the country, who don't have work to send money back to Senegal. I see another question on well, the last question that I am looking at from Martin. What we are currently looking at with stepping back a moment, the Senegalese government has responded quickly with a plan to reactivate the economy. But what we are thinking, we are out of breath. When we were confining, we went into confinement early, but the structure of the economy was not able to hold up because of the nature of the mechanism of how society functions here. our financing and our economy depends very much on the outside of the country. So those governing, we can't judge them today. We could not know ahead of time during confinement for having chosen to undertake confinement, but it's had a heavy economic cost. We have another question here. You've responded to it a bit, but maybe there's something else to add. The question is, I didn't see you speak of the impact of COVID, of the international transfers. Yes, we did take it into account. We wanted to limit, though, the number of hypotheses because there were quite a few. There were hypotheses on the transfers, international transfers, and for each scenario. So the optimistic one, the medium one, the pessimistic scenario. And we took this into account, the international transfers, because in Senegal we have countries in the region that make a lot of transfers, and we wanted to have hypotheses on these transfers. So we did work with our colleagues at the national level to see how these transfers were evolving. And while we're putting the report together, it's in French, but we could share it, and then we could see all the hypotheses that we used, and all the elements that we took into account that are quite complex. But we can include the entire battery of hypotheses and share those. If you were going to classify the main negative impact of COVID-19 on the demographic dividend, what would be the case in Senegal? And would this apply itself also in general to other African countries? Could you please repeat the question? If you can classify the main negative impacts of COVID-19 on the demographic dividend, what would it be in your opinion? Oh, I understand. That is a very complex question. What we observed is that the impact that COVID has, what we economists are discovering in terms of the recent history of humanity, the sectors that are most affected here is poverty. If you look at the dependence, it dropped dramatically, both for men as well as for women. In Senegal, we understand why, because we see that the dependence index of women dropped dramatically from 97 to 4%. And for women, dramatically as well, although it was very low to start. And for us, it's the strongest impact. And then, of course, the impact on the human capital. Because what we saw today, we're still putting together all the data. And for example, for the hospitals, people no longer want to go to the hospital. They're afraid of contacting the COVID. And so there are other effects that we do not yet see. The access to health services has dropped because people are afraid to go. And so we need to wait till the end of the year to see what that impact will be on the behavior due to COVID-19, that people no longer want to go to the hospital. And then education, once again, in terms of the human capital lost, it's the human capital lost is basically in the sectors of health and education. The other problems existed already before COVID in terms of access to infrastructure, networking. None of that is new. The resources to live, to get well, to stay healthy. But this is like a drop into hell compared to where it was. If you lose all your revenue from one day to the next, the drop, the descent into hell is very rapid. People close shop immediately. They had no chance to anticipate this or prepare for it. At the beginning, the government was very, very categoric in closing, very strict, and it did not allow people to anticipate or prepare. It's the first time it had ever occurred. We have another question. What measures do you recommend to the government to soften these impacts on the population? Well, we have a dilemma. It's a difficult situation. The president made the decision to save the economy. So in restarting the economy, so the Senegalese economy depends on the reopening of the country. And even if it may appear to be a contradiction, we are observing that we opened up the 15th, we opened up the airports just a few days ago. On the 15th, we deconfined. We asked people to still respect the distancing and masks separation. But it's a mix of different responses. And everything is going to depend, as I said it earlier. Senegal has an extroverted economy, so whatever the will of our leaders, there is also the international response, because we are interconnected with the rest of the world, with the diaspora. So if the international community or other countries that have a large diaspora, the United States, in 2013, there were 5 countries we found that had a large diaspora. There was Spain, France, Italy, the United States, in Ivory Coast and Gabon in Africa, and in South Africa. And if things are not going well in those countries, then we have a problem here. So it's not only internal measures that we can take. If these other countries have been hard hit, then there's the secondary effect. For example, the tourists that we normally get from France, Spain, Italy, the United States, if they can no longer come, that's a problem. And the current tourist season in Senegal is completely flattened. It's done. It's over. We've lost billions of dollars, billions. This is a terrible year for the tourist industry. What we can say, we have no solution, but we are going to try to restart the machine, restart the economy. And it's like after a war. It's not a given to know what measures to take. It's to maybe have a mix of measures. Reopen the hotels, the restaurants slowly and see what will occur. Another question? It's my question. You mentioned that there could be an increase in violence, gender violence. Based on your statistics, it's already visible. What gender violence is already high in Senegal. What can be done differently in Senegal compared to what we were doing before? How can the response be different now? We're trying to do fast research here on the situation to really capture the size of the problem. What we are discovering, people were not used to all stay together because people were confined. People did not know or experience confinement before. So the phenomenon itself, how it's discovered, how it is lived, because much of the violence is connected to what occurred, that people are living a situation that they had never encountered or lived or experienced. So it needs to have some kind of political or policy response, and we can't say these things happen. We have to say these things cannot happen. But our situation was like a war. Everything stopped immediately. Every day, normally, every day the male worker or the person in the family working gives money to the other person in the family, but there's no more money because everybody is in confinement. And people get upset and irritable and upset. And so all of these things are part of the analysis. It's an unheard of situation up until now. So it's something that Senegalese never had experienced such a major crisis. Over 30, 40 years, nothing like this had happened, where for 3 months everything was stopped and blocked and closed. So it's a very difficult question, Chris. We are discovering the kinds of violence that are occurring. We want to note them. And we want to now propose what can be done about it and have recommendations because there's no going back. And also we don't have much, we're too much in the middle of the problem right now. It's as though you had already mentioned it. The women are are affected much more strongly than men. So how do you see this process of economic restart? What could the government do to adjust these differences, these gender differences, as part of the process of restarting the economy? This is a question that we were looking at before COVID-19, but it's been exacerbated with COVID-19. The Ministry of Women is waiting for this report that I shall be presenting to them. So they want to, because the government is going to put about $2 billion into the restart of the economy, but they're looking to see how to target these funds. There's at least a gap, though, of $2 billion to really get back to the 2019 economic baseline. What we are looking at now with the Ministry of Women is how to restart the activities, the revenue activities with women, because there were a number of programs in place that had been put into place by the Ministry of Women. And with these 3-4 months, everything has fallen apart and has to be we have to start from ground zero again. So in terms of policy, we need to see what funds are for women, what funds will be available what are the funds that will target women. So it will depend on the mapping, the COVID-19 mapping that we will develop to see how to support women to come back into the economic life. This is the situation. We have another question. Children also are often victims of violence, domestic violence. Will they return to school in the fall? Officially, we are told that the schools will continue in September. But what we do know is that during this period, from the month of June, it's the rainy season in Senegal. And during the rainy season, it's difficult to go to school. So there was an official decision to implement a solution to this. And we also know that with the crisis, some children were able to continue their schooling because their parents have some means and they could continue online. But there is a digital bill to be paid. People who are living in rural areas where there is no internet connection were not able to follow and keep up their schooling. So it is quite true. Children are victims, passivisms, but sometimes active, but because the way households are conceived, normally there are 8 to 9 people in a household, and as a child you experience a number of things, and violence is part of it. But in terms of school starting up again in the fall, the official word is that children will be on holiday until September. And we're not sure how the different academies. There's the public schooling and the private schooling system. We're not sure how the different systems will reopen. But this is all I can tell you at the moment. Thank you, Latif. And there was another question in terms of family planning mechanisms. Will there be mechanisms to facilitate, to make it easier for women to access reproductive health services and family planning services? And when can these services begin again? Yes. The family planning services were in existence before. We were working on that. We're partners with Johns Hopkins. We work a lot with this. But with COVID, we have received donations, money and donations in kind to help in the riposte, to help respond to this crisis. But we're currently analyzing the research at the level of the beneficiaries of these programs. I think in about a month to a month and a half we should have the results, not just in Senegal, but in other countries. So we are going to try to get these results to see what has happened in terms of family planning and gender violence, and what kinds of violence have people suffered as a result of COVID-19. We're going to document this, have country reports, and within the framework that we are doing within the country and also with the African Union. If I have another question for you. What are the lessons that you believe we can learn from your analysis in terms of the COVID impacts to keep moving forward? And what are the lessons that the Gates Foundation and we all can learn? We hope that what we have done in Senegal, all countries will be able to see it, because we have worked on the question at a national and international level. We did impact studies that allowed to see the impact on spending, on investments, on the different activity sectors of the macro sector. This was good in terms of the economy at large, but it did not allow the decision makers to decide everything to do with the SDGs but the social dimension was not always clear. So now we are trying to replicate these exercises. The nine countries hope. We are hoping the 9 countries, Sub-Saharan, we are analyzing a rapid research. We are putting together a questions to send out, questionnaires, And this is connected to the report that we are hoping to have in about a month. To try to reorient all the interventions based on the targeted needs. So we have the beneficiaries of interventions in each country. We have the religious leaders at the level of each country. We have online questionnaires. We have community projects, and there are two others that I can't think of right now that allow us to take into account the entire intervention package. So we have formulated a number of precise questions, and so this is how we hope to reach the second phase of the project, which will begin at the next year. We are certain that COVID had an important impact on the SDG indicators, and so we would need to start from scratch, and the SWED is Sahel Women's Empowerment Demographic. That's what the 9 countries that the questionnaire that the professor answered. Those 9 countries. I see another question. Do you think that Senegal was ready to benefit from the demographic dividend if there had not been COVID? The Senegal had the potential, because the NTA said we had the potential existed. This is why we put in place the DDMI. We had the potential. You can have petrol and be poor, right? So what we saw is most of the countries have open windows. The potential exists, but is it taken advantage of? Most no, except for South Africa. South Africa has started to take advantage of its potential, and we have over 10 countries for which who have not yet taken advantage of their DDMI. Senegal had reached at the level of 42.5% before COVID. So with COVID, we know it will drop, as you saw, to 30. It's enormous. So we need to we have to recalibrate and rebalance our situation for us and for other countries. So we did take a look at this during the crisis in Ivory Coast, Liberia. Ivory Coast, it took 10 years for Ivory Coast to get back to their situation after their crisis. It took them 10 to 12 years to come back to ground zero. And the same with Burkina Faso, that is dependent on Ivory Coast. It took them 5 years to overcome the effects of their crisis. So we will see how long it will take for us to recover from this crisis. We hope it will be much more quickly. But since it has touched and affected the economic structures, it is not a given. We can be optimistic, but it is not a given that we'll be able to find new jobs, etc. It's just very uncertain. We would like for it to be much easier, but it just simply is not the case. Thank you so much, Latif. I think that we have, it is now 1:15, and we are going to finish our session. Thank you so much. It is perhaps late and already the weekend in Senegal. We thank you so much, and we hope you will be able to join us in future sessions. Thank you so much to Chris and to the entire team. It's true that it's been a long time that we have not seen each other face to face, physically. Thank you to Bill and Melinda Gates. Thank you to all, to Johns Hopkins, and for the opportunity and for the excellent work that you are all doing. Thank you so much, Latif. And thank you to all for your participation and for the wonderful questions that you raised. Thank you so much, and have a wonderful day or a wonderful evening. Thank you so much. Thank you.